Hello everyone, and welcome back to our channel at VitalityVortex. I was browsing the internet and I saw a video of a mother who brought her daughter to the emergency room, vomiting with high fever, and she described her daughter during her live Facebook feed that her child is having convulsion, and yet nobody is attending to them. And they have been waiting for more than 4 hours already. Yes, you heard that right. The parent of the said kid decided to videotape the situation and put it on Facebook live feed to call the attention of the hospital. As a former emergency nurse for more than 5 years, and now a provider working in urgent care, I was compelled to talk about this ER wait time. Did you know that the average ER wait time in the US is a staggering 2 hours and 22 minutes? Yes, you heard that right. Imagine sitting in an emergency room, in pain or distress, waiting for over 2 hours just to be seen by a healthcare provider. It's a frustrating and stressful situation that many of us have experienced or heard about. This is just an average wait time in the US, but at the county hospital where I worked in Los Angeles, the wait time can range from 2 hours to 12 hours. I remember times when I finished my shift, and people in the waiting room were still waiting to be seen by a provider. Some patients came in with abdominal pain, left to get something to eat, and returned, still waiting to be seen. In this video, we will explore the reasons behind the excessively long wait times in emergency rooms and provide practical solutions on how to address this pressing issue. From understaffing to inefficient processes, we break down the factors contributing to the problem and offer insights on how hospitals can improve their operations to reduce wait times and enhance patient care. If you're concerned about the state of emergency room services and want to learn how we can work towards fixing it, this video is a must-watch. Let's work together to make a positive impact on healthcare accessibility and quality. One of the primary factors contributing to long emergency room ER wait times is overcrowding. Emergency rooms frequently find themselves inundated with patients, creating significant delays in receiving timely medical care. This overcrowding often stems from a variety of issues, including an increase in the overall number of patients seeking emergency care, particularly during peak hours or seasons. Compounding this problem is the issue of understaffing in hospitals. Many healthcare facilities struggle with insufficient medical personnel, which exacerbates the situation. When there aren't enough doctors, nurses, and other healthcare providers available, the staff that is present has to manage an overwhelming number of patients. This can lead to burnout among healthcare workers and reduce the quality of care each patient receives, ultimately prolonging wait times. Another critical factor is the influx of non-urgent cases that crowd the ER. Many individuals visit emergency rooms for conditions that could be treated in primary care settings or urgent care clinics. This misuse of emergency services contributes to the congestion, diverting resources away from patients with truly critical needs. As a result, those with severe or life-threatening conditions may experience prolonged wait times, which can have serious implications for their health outcomes. Additionally, the lack of adequate primary care options often forces individuals to seek care in emergency rooms. In communities where access to primary care is limited, patients may have no choice but to turn to the ER for routine medical issues. This further contributes to the overcrowding and extended wait times, highlighting the need for better healthcare infrastructure and more accessible primary care services. So, how can we address this issue and make the ER experience smoother for everyone? Tackling long ER wait times requires a multifaceted approach that targets the root causes of overcrowding and inefficiency. Here are some effective strategies. One key solution is to enhance triage processes to better prioritize patients based on the severity of their condition. Implementing more efficient and accurate triage systems ensures that those with life-threatening conditions receive immediate attention, while less urgent cases are managed accordingly. Advanced triage protocols and training for staff can help streamline this process, reducing delays for critical patients, increasing staffing levels. Addressing understaffing is crucial. By increasing staffing levels, especially during peak hours and busy periods, hospitals can better manage the influx of patients. Hiring more healthcare professionals, including doctors, nurses, and support staff, can help distribute the workload more evenly, reducing wait times and improving patient care. Additionally, investing in staff retention programs and providing adequate support can prevent burnout and maintain a motivated workforce. Utilizing telemedicine. Telemedicine offers an innovative approach to reducing the burden on emergency departments. By using telemedicine, healthcare providers can evaluate and treat patients remotely, which can help divert non-critical cases away from the ER. Patients with minor ailments or those seeking follow-up care can consult with medical professionals via video calls or online platforms, receiving timely advice and treatment without physically visiting the hospital. This not only alleviates overcrowding, but also enhances patient convenience and access to care. Expanding primary and urgent care. Expanding access to primary care and urgent care clinics is another effective strategy. By improving the availability and accessibility of these services, patients can seek timely medical attention for non-emergency issues outside of the ER. Community health initiatives and outreach programs can educate the public on when and where to seek appropriate care, reducing unnecessary ER visits. Implementing fast-track systems. Establishing fast-track systems within the ER for less severe cases can expedite care for patients with minor injuries or illnesses. Separate treatment areas for low-acuity patients can streamline their care process, allowing them to be seen and treated more quickly, while critical patients receive the focused attention they need. Enhancing hospital infrastructure. Investing in hospital infrastructure and expanding ER facilities can accommodate growing patient volumes. Modernizing equipment, optimizing patient flow, and creating more treatment spaces can help manage peak times more effectively and improve overall efficiency. Public education and awareness. Public education campaigns can inform the community about the appropriate use of emergency services. Educating people on when to seek ER care versus visiting primary or urgent care clinics can help manage patient flow and ensure that emergency resources are reserved for those who truly need them. Now let's shift our focus to a success story that gives hope for improving ER wait times. Imagine a hospital that implemented innovative strategies like streamlining patient flow, optimizing staffing schedules, and utilizing technology to enhance efficiency. As a result, they were able to significantly reduce their ER wait times, leading to higher patient satisfaction and better outcomes. I encourage everyone to help reduce ER overcrowding. As a healthcare professional working in urgent care, I often see patients who haven't visited their primary care provider in years and only seek help when they're experiencing severe symptoms. Remember the old saying we often discuss on this channel: an ounce of prevention is worth a pound of cure. Many people tell me it takes months to get an appointment with their primary care provider, which is why they end up at urgent care or the emergency room. To avoid this, schedule a yearly checkup or physical exam with your primary care provider. This allows your doctor to run tests and monitor your health, helping to catch any issues early and maintain your overall wellness. Of course, if you have an urgent reason to visit the emergency room, please seek medical attention right away. But imagine a world where we all focus more on prevention than cure. It would lead to better health outcomes and less crowded emergency rooms. To wrap things up, addressing long ER wait times is essential for both patients and healthcare providers. By tackling the root causes of delays, implementing effective solutions, and prioritizing patient care, we can create a more streamlined and responsive emergency healthcare system. Remember, timely access to medical care can make a critical difference in saving lives and improving overall healthcare outcomes. I encourage you to share your own experiences with ER wait times in the comments section below. Have you ever faced long wait times in the emergency room? What do you think can be done to improve the situation? Don't forget to subscribe to our channel for more insightful content on healthcare-related topics. Together, we can work towards a more efficient and patient-centered healthcare system. Thank you for watching. Also, click on the video to your right, and the one below is what YouTube thinks you should watch.